Hello, my name is Carson Gibbs, and I'm going to be presenting my practicum project for my BSN. So my practicum project was on postpartum depression. So I will begin my presentation. So postpartum depression educational initiative in the emergency room. So increasing awareness and improving screening practices. So the purpose of the project itself was to increase awareness and understanding of postpartum depression, which is going to be referred to as PPD a lot in this slideshow, among ER nurses through an educational pamphlet and survey. So the rationale behind this is that PPD affects approximately 1 in 7 women, and it can have severe consequences if left undiagnosed and untreated. Emergency rooms often serve as the first point of contact for postpartum patients, making PPD screening crucial in this setting. And this can be the moms coming in themselves for a medical reason or something to kind of keep in mind is that they can also be bringing in their babies and be suffering with postpartum depression. So it's important for ER nurses to have this information in order to best care for these people. So project overview, I developed and distributed an educational pamphlet explaining PPD symptoms, the importance of early detection, and its screening practices. I also designed a survey to evaluate nurse knowledge, pamphlet effectiveness, and familiarity on routine PPD screening. This is what the pamphlet itself looked like. You can see that the front part has information on PPD, the symptoms, risk factors, nurses' role in supporting these patients. There's some information on postpartum psychosis, as well as a whole section that is specific to the emergency department and what the nurses can do. On the back is the EPDS, which is a depression scale that is commonly used to screen for depression and postpartum depression, so that they would have that information if they wanted to be able to use it to screen their patients in the ER in the future and know how to interpret the results. So as far as the goals, so the goal was to enhance ER nurses' knowledge of PPD and assess the effectiveness of an educational intervention. Achievement, I successfully distributed the pamphlet and collected feedback through QR code access to the survey. I increased nurse awareness and supported the feasibility of implementing PPD screening in the ER environment. Objectives. So the objectives were to educate ER nurses on PPD. So I met that because survey responses indicated improved understanding of the PPD symptoms and the importance of early detection. I evaluated the pamphlet's effectiveness. Most participants found the pamphlet informative, easy to understand, and applicable to their clinical practice. And I got feedback for improvement. So I identified opportunities to enhance the pamphlet's design, provide ER-specific screening protocols, and offer additional resources. So completion of strategies with examples of evidence. So there was collaboration with key personnel. So I held meetings with my mentor, the ER manager and director, the unit educator, in order to make sure that the information in the pamphlet was good, that the pamphlet was something that could be beneficial to the ER, and just to make sure that I had approval, that it aligned with the unit's, basically that the unit was good to have it. So I successfully did that. I delivered pamphlets directly to the ER nurses with the QR code so that they could access the survey, and I engaged with the staff to explain the project's goals and encourage participation. So additionally, I had ongoing nurse engagement. So I answered nurse questions, facilitated discussions, and provided additional explanations regarding PPD and its impact. So if they had any questions about the pamphlet itself, the purpose of the project, how it's relevant, anything like that, I had discussions with them to go over that. I collected the survey responses and I analyzed the data to assess the pamphlet's impact and identify knowledge gaps. So as far as the actual survey results, so we found that there was increased awareness. So nurses reported a better understanding of PPD symptoms and the importance of early screening. There was support for PPD screening. So the majority of respondents supported implementing routine PPD screening in the ER, recognizing its potential to improve patient outcomes, and identification of educational gaps. So I recognized that there was a need for further training, especially for nurses with less than 1 year of experience to ensure consistent and accurate PPD identification. And these are just some graphs from the survey that was done. So you can see that 20% of the nurses that responded to the survey had been a nurse for less than a year. So there was, a decent amount of nurses who maybe don't have the experience. So the application of the project, so in practice, I provided a framework for integrating routine PPD screening into the ER workflow to improve early detection and intervention. And for education, it highlighted the need for continued staff education on the subject to address knowledge gaps and reinforce screening protocols. So as far as the value of the project to lifelong learning, I feel like it enhanced my research skills. So it strengthened my ability to critically evaluate research and translate evidence into practical patient-centered initiatives. So I was able to get better at finding articles and studies and the like that relate to a specific subject that I'm trying to research, and then take that information and turn it into something that is beneficial and useful. Improved my communication. I developed skills in presenting information, collaborating with interdisciplinary teams, and educating my peers. And it strengthened my commitment to quality improvement. So I learned how to identify clinical practice gaps and implement targeted educational interventions to improve patient outcomes, because this really is the first time that I've ever done anything like this. And I did enjoy it. And I do think that it will impact my career in the future, and I could see myself taking on a more educational role in the future. So conclusion and next steps. In summary, the PPD project successfully raised awareness to improve nurse understanding and highlighted the importance of routine screening in the ER. So for next steps, I want to implement suggested improvements, such as streamlining the pamphlet design and offering small incentives to boost survey participation. So one thing that I did notice was that not everybody that got a pamphlet completed the survey. So I think if there was something that encouraged them to complete the survey more, it would make it to where I got more feedback and therefore could improve things a bit better in the future. And I can advocate for the adoption of routine PPD screening practices within the ER and continue to provide ongoing staff education on the subject. These are some references that I used through the survey. I hope that this has been a beneficial thing for you to listen to, and have a good day.